My name is Elise Herman, and I'm in charge of all of our behavioral health services here in Charlotte. Not only am I an administrator, but I'm also a physician. What I love about my job is that I get to affect the lives of people, one person at a time, when I'm doing my clinical work. And in growing programs and in building programs and making sure that in our day-to-day, we're delivering the most remarkable care for our patients. So in 2018, if I say the blank epidemic, what word comes to mind? Was it polio? HIV? Opioid epidemic. When I think about the opioid epidemic, there's one patient that always sticks out in my mind. A few years ago, I saw a 24-year-old female at our Kernersville hospital. She was hospitalized for 6 weeks because she was receiving IV antibiotics for an infection in her heart. Her heart valve was infected, related to IV heroin that she was using. As we discussed the guilt and shame that she felt about the addiction that she was suffering from, she told me a story. For 1 year for Christmas, she literally unwrapped every single present under the tree while her family was gone to go and return those presents and use the money to buy heroin. That is the illness that is ravishing our patients. Now, what if I told you twice as many people die from alcohol every year? And 10 times as many people die from tobacco? It's not just an opioid epidemic. We have an addiction epidemic on our hands. In fact, in 2016, the United States Surgeon General wrote a landmark report talking about addiction in America. That report talked about how 22 million Americans misuse drugs and alcohol every single year. That it costs the United States over $400 billion. This is the problem that we have in our hands. And Novant Health is not doing enough. You're right, we do have some addiction services. But what we need is to have a separate addiction medicine service line. Yes, we have our friends in surgery who are doing remarkable work around the ARS protocol and reducing the amount of opioids that people are getting after surgery. And our pharmacists are doing a fantastic job of giving us recommendations about how we should prescribe opioids, what are our options, drug take-back programs. This is not enough. Right now, addiction mostly lives within the behavioral health service line. This is fantastic. And yet, this also perpetuates the thought that just psychiatrists should be treating addiction. That doesn't need to be the case. Addiction medicine is something that any clinician can practice, that really we all should be practicing. And if we had a separate addiction medicine service line, we'd be able to share the expertise. We'd be able to make sure that in every single one of our service lines, we're doing best practices. Just like we brought diabetes to the surface and said 30 million Americans are suffering from diabetes, we can also bring this to the surface and say 20 million Americans are suffering from addiction. And this is affecting everything that we do. With my expertise as a psychiatrist and board certified in addiction medicine, I'd be honored to lead this battle cry. This is what our patients deserve. This is what our fellow clinicians deserve. To know how to handle patients, to know how to help people where they are, to be able to tell that 24-year-old female, we know what we can do for you, not just wait for the psychiatrist. But I, as your nurse, can talk to you about this. I, as your hospitalist, can give a screening, brief intervention, refer you to treatment. That all of us take this as our responsibility. This is Novant Health's chance to be innovators and really turn this tide on addiction. What questions can I answer for you?
So, Elise, great. You had me. I'm like, where have I signed up? So tell me, in your vision, how do you pull this together as the person that would lead this? Tell me sort of what that looks like.
Well, I think it's many things. I think just like the diabetes service line, I think there would be some specialty services that would live within this service line. So one of the things that I would love to do is have specialized clinics that were really just treating addiction. Now, the great thing about this is it doesn't need to be just psychiatrists. In fact, family medicines can treat addiction. There's actually board certification that you can get in addiction medicine that falls under preventive medicine, which allows really anybody who's board certified in something else to treat addiction. So this would allow us to have maybe retired orthopedic surgeons, all sorts of different people who'd be able to treat this. I think that a big part of it really needs to be collaborative care, and how do we get these addiction services everywhere? How do we get everybody to feel comfortable asking the questions about alcohol use? Because right now, people don't, so they don't know what to do with it. They don't know where to send people. They don't know how to have the conversation about, do you think this is affecting your life? Is this really getting you what you want? And there's still a lot of stigma attached to it. So I think pulling together several of the different things that are happening right now in the organization and having it under one umbrella where it was saying, this is the effort that we're making, this is how we're pulling us all together, rather than they're doing this and they're doing that and they're doing this, that would really be the way that we could say, we're making this effort.
So, like Paula, very engaging and just, you had us all. The question that I have, I think is still along those same lines. So as a system now, we are having all of our providers ask certain questions around depression and obesity and those kinds of things. And as a leader in the specialty world, I hear the grumblings of my providers who say, but I'm a cardiologist, what do I know about depression and those kinds of things? So how do you get the engagement, which by the way, I think is the right thing, of those providers who are not psychiatrists, who are not behavioral health, and help them to realize this is your role as well?
I mean, I think for a lot of physicians, you need to show them the data of how much depression really does affect their outcomes, how much cigarette smoking affects their vascular surgeons. I think it really also comes down to understanding, why do they have that? I mean, is that just stigma that's left around that they think, oh, this is still a moral failing? I'm not gonna perform surgery on that addict, right? Because we know that our cardiac surgeons feel that way. It's not going to have an outcome that I want. Well, what if we're saying that, no, we can actually have, you still get the outcomes that you want, but we actually need to treat this illness that's going on as well. I think it takes a lot of education and time.
I was going to add, again, a great presentation and a huge, huge problem, not only with our patients, but unfortunately our team members as well.
Yeah.
But my question is really related, again, to specifics with the service line NAS babies. I mean, we are clearly not seeing a decrease. In fact, it just continues to increase in our NICUs and special care nurseries across the system. So any particular thoughts in that arena with moms and addiction?
Yeah, I mean, I think that OB is one of our huge opportunities to be actually having our OB physicians feel comfortable starting buprenorphine, getting people in treatment while they're still pregnant, helping people and understanding what are the best practices. I don't know that we're really sharing that knowledge of what are the best practices in terms of these things, because we are kind of siloed. I think by pulling it all together and having, oh, that's who I need to go to. This is a problem that we're having. This is where I go for that information. That would be helpful in us being able to spread it throughout the whole organization.
That's a great point, and I just want to add to we're passionate about this as well. The pharmacy brought to our attention prescriptions for discharge for moms. In years past, we have used a lot of medications that there's best practice now. And so just at our last operational meeting, changed the whole standard of discharge, and it was because pharmacy brought that, to our attention.
The discharge prescriptions at the
Yes.
bedside.
Right.
Elise, there's a lot of conversation about how this problem is too big to tackle by an individual facility or individual health system. There's some work in the greater Winston market with two competitors partnering together to address some behavioral health issues. In your vision, are we able as a system to do this by ourselves, or do you imagine some collaboration with agencies in the community, other health systems?
I think that was a collaboration. Yeah. I mean, I think it's a huge collaboration with our communities, certainly our counties for sure. Here in Mecklenburg County, I'm on the Substance Use Disorder Task Force, and that's a huge conglomeration of the people who are really doing the work. It's significantly different here in the Charlotte market in that we don't have an assessment center, we don't have a PHP and IOP that are treating addiction the way that we do in the Winston-Salem market. So in some ways, we've been much more reliant on those relationships. But I think that's an opportunity to also step it up and what we are doing as an organization in addition to strengthening the relationships. Because depending on the markets, we may or may not have been at the table.
Okay, good. All right, time for feedback. Give this one a round of applause first.
I thought you did a fantastic job. Your stories evoked emotion. I thought myself, I need a tissue here at some point, especially the Christmas story. But the thing that I thought you did the best was so many of us name a problem, we name a solution, and then we expect someone else to take it on. But you named the problem, named the solution, and you said, and I would be honored to take this on. So you weren't just passing it on to someone else. You said, it's big enough that I want to take it. And I think that was a great step, a great thing for you to do as a leader.
So I liked when you started with questions, you got us engaged right away, you challenged us to think through it, and you made the question not too hard. But then, after we all thought we got it right, you in a really amazing way told us we were all wrong. Because it wasn't just about opioids, it was alcohol and tobacco, and so you made me feel really good about myself for getting it right, and then really bad about myself. And so I'm really taking me all the way there, so really great job there. I like the fact that periodically you spoke to how you were the expert on this, even in your Q&A when you threw in, I had the task force. That's important because the audience understands that you are the right person to be in front of us. So really nice job. Thank you.
Elise, I'm Jeff. I don't think we've met, so it's nice to meet you. You have a real presence in the way you occupy the space and present, and the way you use kind of the full range of your tone of voice. You have a lot of high impact points, and they came through in your tone of voice and your hands, and in how you use your face and your eyes particularly. And I liked at the start, you started rooted in the ground. Your feet were together, you weren't moving your hands, and you made your high impact statements. And then you shifted and started moving around, and it kind of, had me at least tied into, what is she going to say? And then, the mood kind of changed, but in a way that we could keep going and follow through with you. So just the way you did all that was really nice.
Thank you.
I had one thing, when Kennedy came to talk about his addictions, and we had the opportunity to meet with him briefly in the room, and I walked out and I text messaged Jeff and I said, if he comes back, please don't forget me. I want to be a part of this conversation. Please don't forget Elise.
Of course.
She should be a part of this conversation.
Absolutely.
I thought it was a great opening. You clearly have the data, you had the passion, the personal stories made an impact on us. Just a great use of pausing. And you would have us like, what does she say next? So very well done.
I mean, the thing that struck me was in your presentation, pretty early on, you brought up what you were asking for with the addiction service line. And just the service line, that really was very effective then with the rest of what you had to say.
Kelly, if I can add, I was just going to say, Elise is so passionate when she presents. I mean, the passion is evident. And I always love how you bring in, we've got our surgery partners who are effectively utilizing ERAS, pharmacy partners who are helping us with recommendations. So you have a way to pull in and acknowledge, it feels like there's a bubble of collaboration around you, so acknowledging and pulling in others. I think you do a great job of that.
Tips to make it even better. question earlier, you know, I wanted to know what this addiction service line would be and what it would entail. You got to it with the answer session,
Sure.
but maybe in the presentation that would have been helpful, because I kept waiting for that.
More detail.
More detail. Mhm.
I would say the same, more detail. One of the things that I have observed when someone is delivering a sermon that has really moved me is they start off quietly with very little movement, and then it builds, and it builds, and it builds. What I would say is that was kind of how I saw your presentation. You started very quietly, with very little movement, and then it builds. And I liked the build. Maybe for one suggestion would be not quite as quiet at the beginning. You know, don't save all the build to the end, or a little bit earlier on, just so you can make sure you got your audience, and you can work that quiet, still build, but capture us a little bit more at the beginning.
Yeah, same thing. So it was there was just a little bit of stiffness in the beginning. Then all of a sudden you became animated, and then by the end of the presentation you were completely relaxed
Right.
into it. So maybe it was just a little bit of nerves in the beginning. So find your way to shape that earlier, but otherwise.
Mhm.